So welcome. Today we are presenting from Des Moines, Iowa. Very excited to share Count the Kicks with you. I know some of you have already been exposed to Count the Kicks, and really excited that all of you are here today. We again are working in partnership with the Children's Trust of South Carolina and could not be more grateful for that partnership. We are going to talk about Saving Babies, a guide to talking to expectant parents about fetal movement monitoring. One thing I'd like to highlight are just some of the housekeeping items for this webinar. First, as you know, it is being recorded. And during the presentation, I will go ahead and turn off my camera to conserve broadband, but I will turn it back on at the end of the presentation where we can have a Q&A. The chat function you're welcome to use and plop those questions in there. I will do my best to monitor that, but when presenting, that's difficult. So I can always go back and answer any unaddressed questions. We will be sending out a post webinar email that will have live links to this recording, the PDF of this PowerPoint, and just live links and resources and a way to connect with me or the ambassadors in your state. And that will all come hopefully by the end of today. So please note that if you're a note taker, that is great. Please do it. But if you're just here to listen and learn, and that's the way you work, then that's fine, because I will get everything to you at the end. So let's go with all of that as people are joining us. Thank you for joining us. You can feel free to introduce yourselves in the chat function as we continue. I will go ahead and get this presentation started. So I am Jen Rowry. I am the Director of Advocacy and Engagement for Healthy Birthday, Inc., which is the 501c3 nonprofit that runs the public health stillbirth prevention campaign, Count the Kicks. I came to this work about a little over 4 years ago, and my background is in education, and I believe knowledge is power. I actually was introduced to this, the concept of stillbirth and the devastation of stillbirth when my next door neighbor lost her daughter, Grace. And I was able to witness her and 4 other women, our founding moms here in central Iowa, turn their pain into the fuel for this passion and the creation of something much bigger than themselves and this program. And so when I was neighbors with Carrie and she lost her daughter, I had no idea that stillbirth was still happening. No idea that it was a thing that happened in the 2000s. And I didn't know that it was preventable. Both of those things we're going to talk about today. We're going to talk about the fact that stillbirth needs to be talked about. We need to be shining a light on it. It's much more prevalent than we realize. So let's get started. I would love to start with this video from Good Morning America. It's one of the most powerful and effective ways we've found to educate expectant parents in our use of mom-to-mom sharing through the testimonies of those whose children were saved from counting and tracking fetal movements in the 3rd trimester. We've seen a ripple effect helping expectant parents know about this life-saving tool called the Count the Kicks and the Count the Kicks app. This baby safe story was shared on Good Morning America, and it's about baby Ruby. Let's listen to how her mom, Emily, saved Ruby's life by using the Count the Kicks app.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So that is the story of Ruby. I think there are a couple of things to highlight. First of all, there was a ripple effect after Ruby's story went national. First of all, app downloads went crazy, but we also received 3 or 4 baby safe stories as a result of the awareness that Emily helped raise by sharing her story. Also note, and we're going to talk about it more, she talked about the change in movement that drew her attention. And we are going to talk about those changes in movement and the use of the app later in this presentation. So let's get started talking about Count the Kicks. Count the Kicks is a highly effective, evidence-based stillbirth prevention campaign. It's been developed as an early warning system for moms, and we are saving 1 in 3 at-risk babies here in Iowa. Our campaign is ready to go and low cost, and for the most part, it's no cost to each of you. So before we get very far, I would love to level set and make sure that we're all talking about the same, have the same definition. So as you likely know, miscarriage is the loss of a baby from the beginning through the end of the 19th week of pregnancy. The loss of a baby in utero from week 20 till the end of pregnancy is considered a stillbirth. And stillbirth is actually further defined into 3 categories. Early stillbirths occur between 20 and 27 completed weeks of pregnancy. Late stillbirths occur between 28 and 36 completed weeks of pregnancy. And term stillbirth occurs in babies that are lost 37 or more completed weeks of pregnancy. The risk of stillbirth actually increases at the end of pregnancy. We are a campaign that's laser focused on 3rd trimester counting. The 3rd trimester starts at 28 weeks, although we advise starting to count the kicks at 26 weeks when you are in a high-risk pregnancy. And the key here is that is what research indicates where baby is going to create that normal pattern that mom will be able to track. And so moms may start to feel baby much sooner, some moms sooner than later, depending on, all different physiological things, but anterior placenta, for example, can impact how a mom feels a baby moves. So the movement is something that is, pretty consistent for baby beginning at that 3rd trimester, which is why we advise that. Infant mortality is the loss of a baby that takes a breath earthside and passes within the 1st year of life. On average in this country, we lose 23,000 plus babies to stillbirth in this country. That's a kindergarten room or a school bus full of 65 children a day in this country that are being lost to stillbirth. It is extremely important that we bring this silent epidemic out of the shadows. We talk about it. It's not something that was just happening in our grandparents' generation. It's something that's happening today. And guess what? There are things we can do about it. And that's what we're going to talk about further. In fact, stillbirth is actually more prevalent than infant mortality. We need to address both issues. So stillbirth by the numbers. This is national data we took from CDC Wonder. You'll notice at the bottom of our slides, there are links and also citings for the information that we're giving. We are an evidence-based, research-based campaign. And so the CDC Wonder is where this information came from. So in the United States, we lose a baby in every 1 in 169 pregnancies. but there are vast and prevalent racial disparities that exist and persist within stillbirth, much like many other health issues. Unfortunately, Black moms are more than 2 times as likely, and in some states 3 or greater times as likely to lose their baby than their white friend, neighbor, or counterpart. So they're losing babies at the rate of every 1 in 96 pregnancies is ending in stillbirth. And this is completely unacceptable and needs to change. Hispanic expectant parents are also at higher risk, with 1 in every 199 pregnancies ending in stillbirth. Indigenous moms lose babies at the rate of 1 in every 138 pregnancies. And for a white expectant mom, that number is 1 in every 204 pregnancies. Asian Pacific Islanders, 1 in 233. So as I mentioned, it's just as prevalent, actually more prevalent than infant mortality. And stillbirth is 10 times more likely to happen than SIDS. We talk about back to sleep. It's so important. It's saving babies. Safe sleep is important. But we need to be talking about kick counting and getting these babies here safely and preventing stillbirth as well. So what are the numbers in South Carolina? Actually, they're higher than the national average, and we would love to see see that change. And so that's why we're all here today. You guys are doing a great and amazing work. Your hearts and passion are to protect moms and babies and to provide them care. And that's our heart as well. So the stillbirth rate in the state of South Carolina is 6.84 per 1,000. That means nearly 7 babies per 1,000 births are lost to stillbirth. So that's a 5-year average. So you are in the top 10 of the highest stillbirth rate in the country. That means out of every pregnancy, 1 out of 130 pregnancies ends in stillbirth in South Carolina. So that's 395 lives. That's a lot. And we'd like to see that change. We'd love to save 1 in 3 at-risk babies in South Carolina and bring 136 babies home safely. But we need your partnership and the partnership of many more to make that happen. So let's talk more about that data. So Iowa, I mentioned our founders early on in my connection to them. So our organization was founded out of loss by 5 Central Iowa women who lost daughters to stillbirth, 1 to infant mortality. And they came together to grieve together and to spend time together. But what they really ended up doing was something much bigger and much greater. And this chart shows what happens in Iowa with data with this campaign. And I love to talk about that more. So that red line at the top represents the national stillbirth rate. And the dots and the trend line below, the blue dots here and this trend line below, actually is Iowa's rate starting in 2003 and going through 2021. You can see here where the blue dots meet the red line at the top is 2008. So right here, the year our campaign started. So that's when Count the Kicks kind of was born and soft launched in the state of Iowa. In the next 10 years of our campaign, that trend line continued to go down. Yes, we look at averages. Yes, there are outlier years, especially in a low birth rate state like Iowa. A syphilis outbreak or something like a pandemic, for example, can really impact numbers. And so, but if we look at that downward trend line, here we are in 2021. That is a pandemic year and pandemic data. And we're super excited to say that we're continuing that downward trend line. So 32% reduction. And we would love to see this happen in South Carolina. And in the first 5 years of our campaign, we actually saw a 39% reduction in the stillbirth rate amongst Black women in Iowa. So why are there such large racial disparities? We need to talk about this, and then we need to act on what we talk about. But essentially, after looking at several research studies, researchers point to the following causes for these disparities. Systemic racism, flat out, is a cause for the issues that we continue to have in this country and the disparities that exist and persist. That systemic racism causes toxic stress. Essentially, being an African American woman in a systemically unjust society creates an unhealthy level of stress that leads to real and pervasive health issues that can cause epigenetics, that physiological change, that temporary change to one's DNA that makes them more at risk for and predispositioned to certain conditions like gestational diabetes, preeclampsia, or high blood pressure. which are all linked to maternal stress and are all risk factors for stillbirth. Experts say that Black women are less likely than other races to receive early treatment for these conditions. Some of the reason for that is access to healthcare and barriers to healthcare. Socioeconomic barriers are also a part of that. Research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. So what do? We are centered on equity. We want to make sure that we impact change in the most at-risk communities. And we can only do that by building relationships and trust and sharing this information and allowing those in the communities to carry this information on and to others. So we are working outside of typical healthcare settings. WIC workers, home health visitors, you are key to getting this information to some of our more at-risk populations. We work with community-based organizations, and really we have worked with about anyone that intersects with expectant parents and organizations that are doing amazing work, doulas, et cetera. Our app that you heard about, and we're going to learn more about later in this presentation, comes in 14 different languages, and that continues to grow, trying to knock down all barriers and make sure access is happening. We have culturally appropriate education materials. We have videos and printed materials and FAQs in multiple languages. We are looking to hire a health equity director. Our health equity coordinator just had to step away to take care of ailing parents, and so we're in transition. But during that time, we have contract workers, and we have amazing ambassadors that are members of the BIPOC community that are coming alongside us and making sure that we're continuing to do this work and do it in the right way with representation and the right voices at the table. We are always looking for funding opportunities unilaterally, but especially looking at work that we can do to reduce those disparities. We are an inclusive organization with 100% board and staff training on anti-oppression and structural racism. We improve programming based on the lived experiences shared by people of color. We've held focus groups. We build partnerships. We are listening, we are learning, and we are making sure that we are addressing the disparities that exist and persist, and working within those communities that are being marginalized by this system of racism. Research and evidence. So where did this come from? I said 5 Iowa women lost daughters, they're not medical experts. They had a lived experience. They were smart ladies that asked hard questions and really came to the conclusion that if they could save one baby, it'd all be worth it. And that's exactly what they did. So they started by creating the first stillbirth registry in the country here in Iowa with then Iowa Senator Tom Harkin. Because what they realized pretty early on in their stories is that appropriate data wasn't being collected and research wasn't being done. Honestly, the story in America has not changed in all the years. That continues to be an issue that we continue to fight and face. But they two of them went to Washington, D.C. to present on this stillbirth registry, which eventually led to other states having a stillbirth registry and even a national stillbirth registry. And they listened to a study given by researchers out of Norway. And essentially, these researchers had taken a cohort of expectant parents in their country, educated them fully on learning their baby's normal movement pattern, how long it took them to get to 10, speaking up to their provider if they had a concern. On the flip side, providers were provided the same education and were given the tools and the expectation or the protocol for what to do when a report of change in movement came in, and investigate to help get that baby here safely. And amongst that cohort, there was a 30% reduction in the stillbirth rate through education and action on change in fetal movement. That is where Count the Kicks was born. Janet and Tiffin, the founders, literally said, that's it. That's what we're going to do. That's what we want to do to save babies. And Count the Kicks was born on the Southwest napkin on the air flight home to Iowa. Part of that research study was now and continues to be a medical advisory board, a real champion for us, an ACOG member, former practicing OB at Harvard Medical School, and a professor, Dr. Ruth Fretz. And I love the quote by Dr. Fretz here saying that tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern, starting at 28 weeks, and to speak up if they notice a change. So that's where Count the Kicks, that's the main research. There are more research studies on fetal movement. Like I said, we are an evidence-based campaign. If you go to our website, www.countthekicks.org, there are several research studies there for you to read. So if you want to look at these citations, you want to go to our website, you want to learn more, and you like to dig into the actual research, please, we invite you to do so. So Count the Kicks has been named a best practice by the Association of Maternal Child Health Programs, or AMCHIMP, which is essentially the membership organization or the mothership of state health departments. And after a thorough scientific review, the leading maternal health association in the United States, AMCHIMP, determined that our program meaningfully engaged stakeholders at all levels of practice, ensures improving health equity as an integral component of the overall program sustainability. And it has been externally validated by another entity and replicated with similar positive results in other contexts. So we are a best practice, and we partner with AMCHIMP. We partner with other large organizations that we'll talk about here in a minute. Another item that we'd like to draw your attention to, the CDC has released the Hear Her campaign. Hopefully you've heard of that. And one of the 15 urgent warning signs for expectant parents is the importance of paying attention to baby's movement as one of the key markers for parents to speak up. So there is a recognition in this country that we need to have parents speak up, but they won't if they don't have this education. They won't if they don't have the tools and resources. They won't if they aren't encouraged and given permission in conversations to share their concerns. And so that's what we're here to package for you today. So one of the things that sometimes we get pushback on is providers or medical professionals may say, you know, I don't want to have this conversation because I'm going to just put anxiety of my patients off the chart. And so like it says here, it says one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true. Usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. And that's quoted out of the studies that are in the bottom, on the bottom of the slide. But we actually studied our own app users in partnership with Des Moines University and the Harkin Institute, who actually performed the study. We provided the information and the resources for them to do this work. And what they found is that actually 77% of our Count the Kicks app users reported feeling less anxious because knowledge is power. They felt educated. They felt like they knew when to be concerned. They were given tools on how to speak up. They could share the data from the app. And I would say that women who've experienced loss and are in a rainbow pregnancy, that pregnancy after loss, their rate of feeling less anxious because they go into that pregnancy with extremely high anxiety is actually even higher, that this becomes something that actually keeps them, their anxiety manageable. And I work with many lost women across the country, and this is something they commonly report and talk about. 84% of app users actually reported feelings of bonding with baby, increased connection with baby, learning what baby's sleep habits might be. And guess what? When they arrive and they're a night owl or they're an early morning kicker, sometimes that translates into who they are when they get here, which makes complete and total sense. So at the end of the day, even if the app user is not the mom that needs to speak up because her baby is in trouble, she has connected more with that baby. Perhaps her and her partner have kick counted together, siblings of that baby. And we know that that's going to help in that postpartum period and potentially lower those childhood ACEs. So using an mHealth app to empower mothers to monitor their baby's fetal movement is showing that increased awareness of a change in movement is actually tied to a reduction in stillbirth, which is another piece of that study. What else can maternal fetal movement monitoring do? What other benefits come with it? Reduction of preterm birth rate. Let me give you a living example of how I've seen this applied. Our own executive director actually was a local news journalist, a TV reporter. She did the story on the launch of Count the Kicks in 2008. She then, about a year to the day later, was pregnant with her first child, a son, Hayden. And because of the education she'd received doing this story, knowing about Count the Kicks and the importance of tracking movement and speaking up, she noticed a change. She actually did notice a change at 30 weeks gestation, noticed a slowdown or a decrease in her son's movement. At that time, she spoke up. Her doctor listened, took it seriously, said, hey, I'd like you to go to the hospital and have that checked out. They did the investigating, and unbeknownst to Emily, our executive director, her body was in preterm labor and trying to deliver Hayden at 30 weeks, which we know is very dangerous, very early, and could have lasting consequences and even the potential for loss. And so they were able, because they intervened early, because she spoke up about movement, not because she was bleeding or having pain, anything that was really triggering her to understand this. And they were able to give medication to her, put her on bed rest, and Hayden arrived safely at 40 weeks gestation, not one day in the NICU, completely healthy. And that is one example that I can give you, and I have many others that I've heard as well. Fetal growth restrictions. So when a baby is not getting the blood supply, the oxygen supply, the nutrients that they need, when the pregnancy is not healthy, whatever that is, the placenta is not working right or too small, or there's some kind of clotting condition, or loss of fluid, whatever that issue is, baby is not thriving in utero, and that will show through their growth. So if they're fetal growth restricted, usually the demise of that baby is slow and is shown in their lack of growth. So if we have a mom who's kick counting and she knows what her then healthy baby's normal is, and she can see that change over time in her baby's movement, she can speak up, perhaps, and proper investigating can happen. And they know what to do to help keep mom and baby safe in that situation, whether it's keeping baby in utero and or bringing baby into the world. Please note that women who have stillbirth are substantially at higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. So if women have a stillbirth, they are more likely to suffer health issues or even death themselves. So mom and baby's health is intrinsically linked, and during that time of pregnancy. And so if mom's health is not good, it can impact pregnancy and baby. And if pregnancy is not well or baby's not well, there's an infection, whatever is happening, it can impact mom, a maternal fetal hemorrhage, placental abruption, right? An infection, all of those things can impact both baby and mom. So we actually just released in April a white paper on this about the link between stillbirth and maternal mortality and morbidity, firsthand accounts from 8 American women. And essentially, this is a resource that has just been released, like I said, in April. And the purpose of the paper is to highlight the connection between stillbirth and maternal mortality and morbidity, and how Count the Kicks can help improve health outcomes for expectant parents and their babies. Research shows that the risk of severe maternal morbidity is more than 4 times higher, as I previously mentioned, among stillbirth deliveries compared with live births. As we've already discussed, racial discrimination is a significant factor for adverse birth outcomes. According to the CDC, white women make up 13.4% of deaths due to pregnancy-related causes, while African-American women make up 41.7% of pregnancy-related deaths. That rate is similar to that of women in developing countries. Implicit bias is an immediate and large part of this systemic issue, and we must take immediate action to counteract that. So another thing that I'd like to note is that there was also an increase post-delivery of baby in those first days after, a 15% increase, I think, in the first 42 days after delivery for a woman that experienced stillbirth. So for you nurse practitioners and partner in the partnership or home health visitors that are doing those postpartum visits, I think that's important for you to know and understand that you have a higher risk of issues in that postpartum period after a stillbirth delivery. So let's talk about implementing Count the Kicks. We talked about how we got here, how it was born, the data, the research, what stillbirth is, how prevalent it is. Let's talk about the tool that we've been talking about since the beginning, but not explaining, Count the Kicks. So Count the Kicks is an evidence-based stillbirth prevention public health campaign, and it is an early warning system for expectant parents. The reason we say that is because a change in baby's movement is sometimes the only warning sign and often an early warning sign. A change in baby's heart rate is actually a late warning sign of distress and a very serious warning sign because you have a heartbeat until you don't. So we want to have that early red flag, that early warning system to try to prevent a baby's heartbeat from stopping. So our campaign educates women on the importance of tracking fetal movement using our mobile app, and we have downloadable paper kick counting charts in multiple languages: English, Spanish, Haitian Creole, Swahili, and Navajo currently can be downloaded for free from our website. We also have these wonderful bands that we're going to talk about that if a mom does not have access to mobile technology can be provided to you thanks to the funding by the Children's Trust to actually have a wristband for kick counting. So we're going to talk more about that in a little while. This empowers moms to be in tune with their baby and their body, to trust their instincts, and to speak up if they have a concern. I cannot emphasize enough the importance of providers and the support, the healthcare support teams, giving moms permission to speak up, because a mom will hesitate. They don't want something to be wrong. They might not trust their instincts. They don't want to be dismissed. They're worried that they're panicking. All those things can interfere with action. So it's extremely important that they have this education, but they also have had the conversation with their healthcare support staff that they should speak up if they notice a change, that it's important that you want them to. You'd rather they speak up and have nothing wrong with their pregnancy and their baby than to not speak up and have the opposite be true. And we've talked about the saving 1 in 3 at-risk babies. So why does movement matter? Movement is one of the, like I said, very important ways that a baby communicates before birth. And quite honestly, about the only way that they can communicate prior to birth. So a change in baby's movement can be an early warning sign. And as I said, often early warning sign or only warning sign. So why does a baby's movement change when they're in distress? And the best thing I can do to explain that to you is to think about when you don't feel well. Think about the last time you were sick. Did you go about your normal activities a day, clean the house, go for a jog, go to your work meetings, or did you go to your bed and your couch? When we're not feeling well, we conserve energy, right? Like we slow down. Babies are just like you and I. When something's not feeling good, when they're in distress, they're going to slow down. The other thing, think about the last time I had the stomach flu, awful, right? I have a 2-story house. I tried to go up the stairs to the 2nd story. Normally on a normal day, I just bounce up there, not think anything of it. But after being that ill, I'm shaky, I'm weak, I'm sweaty. It takes a lot of effort. Babies who are in distress will also conserve energy to try to save oxygen and blood flow for their vital organs like the brain and heart. And that means they will slow down or stop moving during that distress. So there are really 3 types of movement changes we talk about, and probably the most common one is baby slows down, fewer or no movements. The second is that strength of movement. Baby gets weaker. So you noticed in the video, hopefully when Emily Ecoff was talking earlier on about baby Ruby's movements changing, she said they happened less often and they were softer, more subtle. Baby was getting weaker. And finally, the third type of movement change is a wild, sudden surge of movement, almost violent. If you're far enough in the pregnancy, you can literally see baby moving from the outside. And so that is definitely a concerning movement pattern. And again, another reason for moms to be checked out. So since kicks matter, let's start counting. When should a mom start counting the kicks? 28 weeks gestation if they're in a normal pregnancy, or 26 weeks if they're considered high risk. And I mentioned this earlier, that it's been established that is when baby actually has a consistent pattern that mom can feel and track. What counts as a kick? rolls, kicks, jabs, anything except for hiccups, because hiccups are involuntary movements. So hiccups should not be counted. Some, first time moms especially will ask, what does a hiccup feel like? How do I know if baby has hiccups? Difficult things sometimes to share. And so what I would say is, my experience, and perhaps some of you've had experience, it's that rhythmic, spasmic type feeling. And that's, hiccups are basically muscle spasms. And so it is very consistent, it's rhythmic, it's spastic. It is not a normal type of feeling like when baby pushes, kicks, or jabs. So hiccups do not count. And how to count the kicks to be in tune with your baby and your body. Essentially, what we would like to see is mom paying attention. What is a normal activity time for their baby? Is it after dinner? Is it right when she wakes up in the morning? Find that normal time that baby is active. And every day, at preferably the same time each day, count the kicks with the Count the Kicks app if you have it, or the kick counting chart, or the wristband, and learn what's normal for your baby to get to 10 movements. So every baby and every pregnancy is different. My children were all very active babies, and I would say they average getting their kicks from 5 to 10 minutes. I could have counted their kicks. My colleague, her son was just like my children, very active. Her daughter, it took on an average 30 to 35 minutes for her daughter to get to 10 movements. So every baby, which makes complete sense, and every pregnancy is unique to within itself. So tracking how long it takes baby to get to 10 movements is learning your baby's new normal movement pattern. After about 5 to 7 days, moms will be able to say, my baby normally gets to 10 movements in 15 minutes, or whatever their baby's normal is. So every day they track movement, and if they notice a change, and if it's like baby like slowly slowing down, like we talked about those fetal growth restrictions, mom needs to speak up. Or if it's like a significant change, like she notices, gosh, it took 10 minutes every other day, but it took an hour and 30 minutes today. That is not normal for my baby. I need to get checked out. So using the free Count the Kicks app, this is our hallmark tool. It is 100% free. You can find it on both the Apple and Android products. It is evidence-based and available in 14 languages that are listed here, and that list continues to grow. If you serve a population that their language is not represented here, I encourage you to share that with us and share that with the Children's Trust, because that's something we can partner in to keep adding languages to this app, keep knocking down barriers. Users can restart their session or delete a kick. They can set a daily reminder to count the kicks. They can review their kick counting history. They can download and share with their provider, family, or friends via text or email. You can count the kicks for twins on the app. Anything more than twins is not trackable, because science would say, or research says, that mom can't figure out 3 babies' movement patterns. And I think there's a little trick to learning baby A and baby B when tracking for twins, but it's definitely possible. You can track future pregnancies on the same profile. You can manage multiple devices. So if you have an if you have an iPhone, for example, an iPad, and an iWatch, they can all be synced together, and you can count your kicks on any of those devices. And like it shows in the picture, counting is available on your Apple smartwatch. I have not been pregnant since Count the Kicks was founded, but I am a tester of the app occasionally, and I can tell you that it is extremely helpful to count the kicks on your wrist. So that is very easy for moms to do. Based on the research, the evidence about strength of baby's movement changing, we've added a new strength tracking and notes feature to our app. And so you can see over here how to track that from light to light is fluttery, all the way to fierce movement, which is 5. And mom becomes kind of in tune to what it normally feels like. So she subjectively is paying attention to the strength of her baby's movement, how that movement feels. So that happens after the kick counting session. And then mom puts in her chart here, how many footprints it took to monitor her strength. She can put in a note if she likes. And this one, it says, baby felt strong like normal. And then she finishes the session and she will get this graph. This is the visual way that kind of shows that there's been a change. So it was pretty obvious that this baby's normal was pretty consistent. Strength of movement was pretty consistent. But for whatever reason on this day, it took a lot longer for baby to get to 10 kicks. And at the same time, mom's noticing that there's a change in the strength of her baby's movement, much like Emily would have noticed with Ruby. That's a visual cue. That's information that she can use to be like, I need to trust myself here. This is definitely not their normal. It's time to go get checked out. We also have videos that help educate expectant parents in the app. They're baby safe stories. There are so many great tools and education within the app, which has no ads or pop-ups to interfere with the information mom is getting. The other thing that has been added to our app, we know social determinants of health, like lack of access to healthcare or poor dental care, or not being able to find housing or childcare. All of those things are barriers in a pregnant woman's experience that can impact their health and the outcome of their pregnancy and the health of their baby. And so really within this find resources section of the app, a individual can put in their own zip code and pull up all the programs in their zip code that offer free or reduced services in the categories that are listed above. And trying to get people to where they need to go to get those resources. If you notice that something's not in your zip code, I strongly encourage you, and I will not be offended if you do it right now, to pull out your phone and download the Count the Kicks app. I'm not much of a multitasker, but if you are and you can listen and learn and download the app at the same time, it's so important that the person that's the educator, the person that's working with the expectant parents, knows how this app works, that they can literally pull out their phone and educate others with it. But again, if you notice there's a program missing from your zip code, this is a growing list, a living list, and you can always reach out and let us know. Here's a short video to show you how to use the app.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
As you can see, it's easy to use the app and takes out the guesswork of remembering how long it takes and empowers moms to speak up if there's. So Count the Kicks. How do you integrate it into the work that you're doing? So that is really the million-dollar question. It needs to apply to you. And I think it absolutely does. If you're working with expectant parents, this absolutely applies to you. So let's talk about integrating it. First, talking about stillbirth with expectant women. We know that it's not a light subject. It's not maybe an easy subject, but it's an important one. We don't not talk to women about taking folic acid and prenatal vitamins because of the health issues that might come if they don't. We don't tell them to not take their gestational diabetes test or to go get their mammograms because we want them to be afraid of getting gestational diabetes or cancer, because we want them to catch early warning signs and be able to prevent or at least treat as quickly as possible those conditions. Stillbirth should not be the exception to the rule. Kick counting is preventative medicine, and it should be a standard of care in this country. So some things that we might hear are, I don't want to scare moms. And as I mentioned, pregnancy is full of risks that we talk to moms about. Stillbirth is another risk that moms deserve to be educated about. They deserve it. Everybody deserves access to information. Stillbirth just happens. There's nothing we can do. There are things we can do. Research says that 30% and higher, many research studies say even higher, of stillbirths are preventable. And that could be, if we saved 30%, if we had the same results across the nation in all 50 states that we've had in Iowa, saving 1 in 3 at-risk babies, we would bring 7,500 babies home alive in this country every single year, and potentially saving the lives of their moms as well. Her baby is always active. It's not a concern. Babies are active until they aren't. Cord and placental accidents can be sudden. Moms need to know what's normal so they can notice a change. I have several ambassadors, they're high-level volunteers that I'm going to draw your attention to at the end of the presentation. And they had very active babies. And one of them would say that her daughter was her most active baby out of 4 pregnancies. In fact, she was so active that she learned to disregard her movement, to tune it out, that it was a distraction. And so she was unaware of when that change in movement occurred. And doesn't know if she would have noticed a change over time, if she would have had time to speak up and bring that baby home. So all babies need to have monitoring so moms know that baby's normal and will notice if something changes. She's almost at her due date. As I mentioned earlier, the risk of stillbirth actually increases as a mom approaches, and especially as a mom exceeds her due date, the risk of stillbirth is substantially higher. And moms definitely need to be in tune with their body, their baby, and kick counting, and being willing to speak up in that part of their pregnancy. Talking to moms about stillbirth who've previously experienced it, I think that it's really important that you know that information ahead of time. So if you have information provided on a client or a patient, make sure that you have read that information before going into that conversation. Since women who've had a stillbirth are now considered high risk, they need to start tracking movement at 26 weeks. You need to be empathetic and compassionate. That baby is a family member. It has a name oftentimes. It is loved. It is missed. Asking about that baby and using that baby's name to most lost moms is like the highlight of their day. They want that baby to be remembered. And one of their biggest fears is that people won't see that baby as real, as a part of their family. They won't remember and honor them. Stay away from medical terms like fetal demise. It's a very, very important thing to enter that room with a softness. And I'm sure all of you do that. A lot of moms we talk to have had previous live births. We don't want to add guilt, like they maybe didn't track movement. So we just want to make sure that they have this tool in hand without saying anything that might trigger that guilt if they did not know about tracking or did not track fetal movement in that pregnancy that ended in loss. So some common myths. I think that this is one of the more important parts of our presentation, because guess what? Our society perpetuates myths by sharing. And sometimes women pass myths to women and healthcare professionals to healthcare professionals. And those myths get perpetuated on the internet and in social media. So I think it's really important we talk about this, and this myth busting section is a really powerful tool of information. My baby's always active, so I don't need to count the kicks. I just addressed that, so I won't go over it again, but that is false. Only those experiencing a high-risk pregnancy should pay attention to their baby's movement. Again, false. All expectant parents deserve access to kick counting and count the kicks. Most of the women I work with had zero risk factors for stillbirth. Had they known about movement monitoring, they may have had a chance at getting that baby here safely. So every expectant parent deserves access to this information. My baby should get 10 kicks in 2 hours. False. Every baby is different, as I mentioned earlier, and the recommendation to expect 10 kicks in 2 hours is actually outdated. Current research indicates moms should work to understand the normal amount of time each day it takes their baby to get to 10 movements. I can just use a Doppler device to monitor my baby's well-being. False. Remember, a change in a baby's heartbeat is one of the last warning signs, and when baby's in serious distress. We want to find that early warning sign. We also don't want moms ordering Dopplers off of the internet, untrained, quality of devices at question there, and hearing their own heartbeat and reassuring them not to speak up when they indeed should be speaking up. So we keep Dopplers with healthcare providers as our recommendation. If baby isn't moving, I should drink cold water or eat something sugary to get baby moving. False. Research has moved away from the idea that sugary drinks and the like are a good way to get baby to move. Kick counts are best monitored without interventions like juice, candy, cold water, etc. If a baby isn't moving like normal, parents should speak up to their provider right away. We shouldn't trick the test. If baby's trying to tell us something, we need to investigate. Babies kick less near the end of pregnancy. No, no, no. Babies do not, absolutely 100% false, run out of room at the end of pregnancy. The types of movements that mom feels may change. There may be more jabs and fewer rolls as baby isn't able to make those full turns. But babies should move up to and even during labor. And if you think about it, it's a living being. It should be moving and breathing and doing all the things that we do all the way through that pregnancy. It should take about the same amount of time to feel 10 movements at the end of pregnancy as it did at the 28-week part. Triage doesn't need any count the kicks education. Actually, labor and delivery triage is the perfect place because that's where mom might come with a concern about pregnancy. It may or may not be movement. It could be bleeding. It could be their blood pressure, whatever it is. But many women come, an investigation is held, and then they leave that facility still pregnant. They need this information. They need to know how to track that so they'll know if they need to come back. Pregnant people should avoid dental care. False. Good dental health is always important. Pregnancy can actually increase an expectant parent's risk of dental issues, thus their overall health issues. So think about your system. So I have a variety of individuals on the call today, but most of you are in the home health visiting realm. And so think about how you can work this into your system as a team, as an individual. How do you connect to your community? How do you do this work? Where can you put materials? Where can you share this education? When are you with expectant parents to make sure that this touch point happens? If you have a staff, make sure that the person answering the phone, that kind of gatekeeper for the office, knows that if a mom calls with a concern, that can't be triaged with a 3-hour callback. That's an immediate connection to a healthcare provider, or that person needs to be asked to go to their nearest labor and delivery or emergency room. Where can you include this in your family care or your intake forms? We actually have organization that Count the Kicks. They have an intake form, and it's a Count the Kicks, a paragraph on Count the Kicks, and the importance of monitoring movement is actually in that intake form that families take home with them. Glucose testing is the perfect time for a mom to have this information given to her because she's going to have time to read that brochure. She's going to have time to download the app, practice and play with it, and have a healthcare team around her to answer those questions. In the home health visiting sector, I know that you're spending time with these individuals and you're building that relationship. So thinking about like having that conversation every single touch point you have in the 3rd trimester is really key. Do you have electronic records that this could be flagged in so that you don't forget to have the conversation? You know you're having the conversation at the right time. And do you have any phone recordings for your offices? If so, when I go on hold for a doctor's office, I hear all kinds of announcements and updates and information about that healthcare system or events that are happening. Make Count the Kicks a part of your phone recording. So what resources are available to you? Super excited to let you know that you do have access to a toolkit of resources thanks to the funding by the Children's Trust and their partnership. We're super excited about this. Some of these toolkits were sent out earlier. We have a second wave of materials available to you. What's in that? Count the Kicks picture-based materials. We are actually no longer calling them low literacy materials, picture-based materials. Kick counting wristbands. I talked about that. You can see a picture down here of that band. Essentially, there are numbers 1 through 10. And every time mom feels a kick, she slides that from 1 to 2. from 2 to 3. When she starts her kick counting session, she notes the time. When she ends it, she notes the time. So she will learn how long it took her baby to get to 10 movements to learn her normal. We have instruction cards for you and for clients. There's a letter of introduction, access to many resources as well. We have asked, and I think Katrin did send out this Google form, that you let us know what you need so that we can make sure to get that to you. I actually will put that information in the follow-up email and would love for you to fill. It takes like literally a minute of your time. Fill that out for us today after this email comes out to you, so that you, and if you have that in your email box and haven't done it, go ahead and do that and let us know what you need. We would love everyone to have these materials. They're already purchased. They can come to you free of charge. Our educational materials, first of all, it was important to our founders from the get-go that our campaign not be a fear-based campaign, that it be educational and empowering, giving a voice to expectant parents, giving knowledge to expectant parents. And we work with obviously healthcare providers to get these resources in the hands and this education in the hands of expectant parents. So if you look at our materials, they are bright, they are cheery, they are not medical in their appearance, and the language is very direct and mom-centered and mom-focused. We have promo posters in English and Spanish. We have the how-to poster, which is what you see here on the screen. And we have those obviously in English and Spanish. You can order these anytime. The state health department in your state has provided these free of charge. So in addition to that toolkit, if you ever need our regular Count the Kicks materials, you absolutely can go to our website and order those and have them delivered at any time. Our brochures are really key to providing education to that individual. The posters could be in community centers. They could be in WIC offices, they could be in food banks, they could be in libraries, they can be in all medical types of facilities. Catch the attention of moms, grow that awareness. If you need to have some CE trainings, we would love to offer you our low-cost training on Count the Kicks, which currently is worth $2.25. I notice I'm missing a 5 on that slide, apologies, CE. So I will again share that link following this presentation. What are our Count the Kicks ambassadors? And I know we have about 3 minutes, so I'm going to be really quick here. These are women who are volunteers that are passionate advocates due to their own experiences. Most of them are experienced a loss. A handful actually saved their babies using this information and education. And then we have a growing team of birth workers, primarily doulas, that are very passionate about women in pregnancy and safe outcomes, and they are joining our team. They can do so many in-person things. There are boots on the ground. They can do trainings like I'm doing today. They can fundraise, grow partnerships, give interviews, attend conferences and baby fairs and more. And you have 2 amazing ambassadors, Emily McConnell and Danielle Barkley in your state. And they are actually hosting this fall. If you have not heard of it, but there is a walk of remembrance, Miles for Margaret, Lydia, and Babies Gone Too Soon, that actually raise funds for Count the Kicks, but also gives an opportunity to celebrate those babies gone too soon and bring together that community. South Carolina Baby Save, Danielle actually shared information at the ballpark with baby Olivia's mom and Catherine, took that information and used it. And she said, my doctor explained that the cord was around her neck and was likely why her movement decreased, and was just as relieved as we were to have her here healthy. I will never be able to express my gratitude to Count the Kicks for teaching me the importance of truly listening to my baby. Next steps, download and familiarize with yourself with that Count the Kicks app. Practice, 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 share, share, share. Make sure you fill out that Google form that I'm going to share with you, or that you might already have in your email box from Katrin. And make sure you let us know what you want in that toolkit. If you need additional materials, they are 100% free at www.counttthekicks.org. If you have someone in your office that is responsible for that type of work, designate them to order those materials and keep them on supply when you need them. Take 3 to 5 minutes to educate your patients and talk to them every single time you're with them in the 3rd trimester. Make sure your entire staff knows about the campaign. Use those electronic health forms, intake forms, update your discharge papers, etc., to make sure you're sharing Count the Kicks and all those resources with patients. And remember, Hours and minutes matter in preventing stillbirth. Educate patients, and staff on how to expedite those concerns. You are a part of that education. What do you do if you have a concern? You call. Who do you call? What's the phone number? What should you do if you don't get anyone? How long should you wait? All of that are things those are questions moms have. Make sure they know what to do if they have a concern. And it is exactly 11, so I will share a link to this great story about Baby Save Nala, but I'm going to skip it today for the sake of time. So let's save babies together, and I would invite you to connect with me. I am here. I am willing and able to answer questions at this time and at any time that you may have them. So let's go ahead and ask any questions you may have in the chat at this time. I'm not seeing any. I don't feel like I missed anyone. If you have questions, please go ahead and ask. If not, I really do appreciate the work you're doing. I really think that we have a great partnership here, and I would love to get those toolkits mailed to you. So please make sure you use that Google link. Please look for that in an email that'll be coming today into your inbox. If you've registered, you're going to get that email. And some of you may have that already from Katrin as well. So any questions that you may have, let's ask those in the chat. Well, hopefully that's because I covered everything you needed to know and that it was a thorough presentation. Again, thank you to the South Carolina Children's Trust for their investment in Count the Kicks so that you had access to this training and these free resources and tools. And thank you so much for joining us today. We so appreciate the good work you're doing in your partnership.